Peterson. I feel like I kind of have given up on my last name, Chris. That's okay. It's okay. I'll take it. I'll take Nicole. All right. I'm here to talk about two things quickly. One is testing. What is vaccine definition? I noticed that we're starting the testing, the optional testing at numerous schools in Minnetonka. And I wanted to just give my psychic prediction like I do every time I'm here. Because you guys are starting testing, you're going to see an increase in cases. Shocker. So unless you have a positivity rate that you're going to use, if you're just going to use cases, you're going to have a spike, for sure. And because of your quarantining policy, you're going to have lots of kids quarantined. And my prediction is you're going to use both the quarantine numbers and the case numbers, October 7th, as evidence of something, right? That there's a spread. So what I want to make sure you understand is that the test in and of itself that is being used by Vault is not very reliable. And how do I know that? I know that because the state of Minnesota says so. All right? So the state of Minnesota says that the test is as is, that it's not reliable to diagnose anything, that you assume all risk with the test, that the state doesn't assume any risk, and it's incidental, and it's not meant to diagnose. So we're going to be using a test, we're going to be using the case numbers, we're going to be using the quarantine based on this test that's inaccurate, and nobody's taking any responsibility for it. In addition, the World Health Organization has advised against screening with testing. What do I mean by that? Depending on the cycle thresholds for these tests, there's a high false positivity rate. So what the World Health Organization has said is that the only time you should be testing is if there's symptoms, and if you're doing it in consult with your doctor. That's not what we're doing. So we're just testing healthy people. Now, what is the false positivity rate when the cycle thresholds are high? Well, according to the New York Times, it's 97%. One of the reasons we're testing is because we are under the belief that there's asymptomatic spread. Now, if you look at the literature and you look closely, which I do, they always throw asymptomatic and pre-symptomatic spread together. And there's a huge difference. Asymptomatic spread is when you test for COVID, you have a positive test, but you never have symptoms. You never get any symptoms. According to the CDC, that's 1.3% of any cases. Extremely low. With the false positivity rate, I would opine that those people never had COVID. Now, pre-symptomatic spread is when you don't have symptoms, and you can get someone sick, but you will be sick. That's what we see with the flu, that's what we see with the cold. So 2-3 days prior to you having cold symptoms, if you're walking around, you're kissing your spouse, you could pass on the cold or the flu, but you will get sick.
You're at 3 minutes.
Thank you, almost done. Now that makes up over 13% of the supposed asymptomatic spread. So why am I bringing this up? I think we're creating a problem that you guys are going to use October 7th to crack down hard. And it's a problem of your own making. Using a test that's unreliable. I know from World Health they're using 37 cycle thresholds. Just FYI, the NFL uses 25. Dr. Fauci said anything above 25 is noise. So, the state of Minnesota doesn't trust this test. The WHO says don't test healthy people unless it's under a doctor's advisement and there's symptoms. And you guys are going to use these cases for quarantining. You're going to use all that October 7th. So I think you're setting yourself up for failure. And you're also setting our kids up for failure. Thank you.